Are you wondering if you should be taking magnesium for chronic pain? Or better yet, are you wondering why you should be taking magnesium for chronic pain? Are you concerned about what types and what doses of magnesium you should be taking? If so, you're in the right place. Because in this video, I'm going to break down all the different mechanisms by which magnesium can help your chronic pain. And by the end, you'll have more confidence at selecting the type and dosing of magnesium that's best for you. You've likely been told to consume more magnesium for your chronic pain, but do you know why? Well, the first reason is magnesium is nature's muscle relaxer. We zoom in on our guy's massive bicep here. On all of your muscle fibers, you have a receptor called calmodulin. When calcium binds to calmodulin, you get a muscle contraction. That muscle will stay contracted as long as calcium is bound to calmodulin. Magnesium is what displaces calcium from calmodulin, allowing that muscle to relax. So if it feels like you have tight, achy muscles all the time, it very well could be a magnesium deficiency. And now I know what you're going to say next. You've already tried magnesium and it doesn't work. Well, the form of magnesium and the dosing makes a huge difference, and I'm going to break that down later this week. The second most important reason why we take magnesium with chronic pain is to stabilize ATP. Remember, ATP is your energy molecule. It not only helps you to get through the day and do all of your chores, but helps you heal those damaged tissues. However, on its own, adenosine and its triphosphate group, ATP, is an unstable molecule, and we don't like unstable molecules. So, magnesium to the rescue. Magnesium binds to ATP, making it more stable to be transported around your body and get to the tissues it needs to, like those damaged ones in chronic pain. But now you're probably going to say, well, I've tried magnesium and I don't feel like I have any more energy. The type and dosing of your magnesium matters more than anything, and I will cover that later this week. Third most important reason is to help fight chronic inflammation. If you remember from our talk last week, we have the nice anti-inflammatory omega-3 fatty acids, EPA and DHA, which primarily come from organic grass-fed meats and wild-caught fish. However, this isn't for everybody. If you prefer to get your omega-3s from plant sources, you're going to be consuming ALA, which on its own doesn't really do much. Your body has to convert ALA to EPA and DHA to have a good effect. So we've got this pathway that requires a few steps and a few enzymes. The first and last being delta-6 desaturase, and that requires magnesium, of course. So to help maximize this already very inefficient pathway, you need to make sure that you're getting plenty of magnesium. The fourth most important reason why we consume magnesium for chronic pain is to help reduce pain signals at the cellular level. On the cell membranes in your brain and spinal cord is a receptor called the NMDA receptor. In order for that receptor to activate and open, it needs glutamate and it needs glycine. When this does, receptor opens, allowing calcium to come through, causing an action potential, which creates pain. Well, magnesium does two very wonderful things in this situation. One, it keeps the amount of glutamate in your body in check, so you're not creating extra, therefore causing aberrant pain signals. The second thing is it binds to this receptor site really well. So even if it's open, calcium can't get through and therefore cause excess pain. Now, the reason why this is so important is this is a very potent pain receptor. It's just one, but it is a very potent one. And this is what ketamine therapy targets when treating things like CRPS. In fact, magnesium has been shown to bind to this receptor about 81% as well as ketamine, which is very impressive and a great alternative to that therapy if it's not for you. Magnesium in other studies has also been shown to reduce the amount of morphine needed post-surgically by about 50% due to this mechanism. So now you're wondering, well, I take magnesium, why am I still experiencing this much pain? The reason may come down to the form and the dosing, which I will cover later this week. As promised, the type and dosing of magnesium for chronic pain. To start, magnesium is an unstable ion. Therefore, it needs to be bound to something to be absorbed. Usually something from this list, a list I know you've seen 100 times before, with the promise that if you have achy muscles, you should take magnesium malate because the malate's going to shuttle the magnesium to your muscles. In reality, that was a little misleading. These molecules don't shuttle magnesium to specific locations. In reality, it's these molecules that are providing the desired effect. So malate is helping your muscles, threonate is helping your cognition, less so the actual magnesium. But in the case of chronic pain and all the examples we've talked about this week, we want magnesium. We don't want this stuff. So the name of the game is absorption and bioavailability. That's always going to come best from foods. So getting magnesium from nuts and seeds, green leafy vegetables, beans, grains, great. But the chronic pain sufferer typically needs a little bit more and a controlled dose. Therefore, we look to supplementation. So again, the name of the game is bioavailability and absorption. Therefore, we look to glycinate and citrate. Those are the two most bioavailable forms. We do not want to entertain magnesium oxide. This is the most common magnesium supplement out there. It's a diuretic. You're just going to pee it out. So the recommended daily allowance for magnesium is set way too low, as it is for most things. This is set for survival, not for thriving or getting out of chronic pain. You've also heard the same thing over and over again about how magnesium is used in over 300 processes in the body, yada, yada. Case in point, it's really important and it's used everywhere. But it's always going to go to your life-saving organs first. So if you're consuming magnesium, it's going to go to where it needs to keep you alive. If you have leftovers, then it's going to start going to things like your muscles to relax them, decreasing inflammation, decreasing pain, all the things that we talked about this week. So to help you get there, we first have to start with a pretty high loading dose. Get your entire body saturated with magnesium, and then we can start to bring that down. So to do so, you have to play with it. There's no standard dosing. It's very individualistic. Start with, usually magnesium comes in a capsule, so start with one of those per day. After a week, you don't notice any difference, bump it up to 2, bump it up to 3. Keep going until you feel that benefit you're looking for. You know you've had too much when you start to get loose stools, then you just back off a little bit. This is your loading dose. Keep it going for a while. Then you can start to play with your dose and bring it down to see what is your daily working dose. Well, there you have it. That's why we take magnesium for chronic pain. Now remember, magnesium is not a cure-all, but it is an important piece of the chronic pain puzzle. And now you have the education and the confidence to keep treating yourself.